Well, hello everyone. This is Cass Terry. My actual real first name is Leon, but my middle name is Cass, which was always my choice. Uh, and I am here basically because I'm a PharmD, amongst other things. And I have been very concerned because I have good friends who are pharmacists in actual clinical practice right now. They're working in retail pharmacies, mostly chain stores, and by chain stores, I mean those such as Walgreens, CVS, Walmart, what else? Target. There's a whole slew of them, which I'll explain in a few minutes here. But I'm here because I'm concerned about the future of pharmacy, and that's why I'm making a series of videos. And I'm going to show you my blog that I've written. It's on the internet, and the address, it's 5 chapters. The first chapter is called Unhappy Retail Pharmacist. Chapter 1, The Salad Days. And the address is right here as I'm pointing to or circling with my pointer here. I'm not going to, you can read as well as I can, if not better. So, and I just want to tell you one more thing. I like words, so I am going to explain the meaning of the word salad days, which I love that expression. It actually refers to youthful times accompanied by the 4 I's, which are inexperience, idealism, indiscretion, and innocence, and it's sometimes accompanied by a lot of enthusiasm. It actually derives from Shakespeare, who wrote Antony and Cleopatra, who Cleopatra said, "When I was green in my judgment, cold in my blood," it's like the first time around the block is basically what it means. So sorry for that aside. And pharmacy. A community pharmacy is what we call a chain pharmacy if the organization consists of 4 or more stores. There are 2 career paths in chain pharmacies: staff and management. I'm going to focus on staff, pharmacist, and retail chain stores. Now, just a brief definition here. The first pharmacy school in the U.S. was founded almost 200 years ago. Now there are about 128 pharmacy schools just in the U.S. alone. And if you look at pharmacists overall, of all sorts, they most work in a community setting, such as a retail drugstore or healthcare facility. And as I say, the majority spend most of their workday on their feet. As you all know, because I suspect those who are listening to this are pharmacists mostly. And commonly, community and hospital pharmacies are open, as you know, for extended hours or around the clock. So pharmacists may be required to work nights, weekends, and holidays, as my friends are. And as a staff pharmacist in a chain pharmacy, about 70% of your time is used in dispensing prescription medications, which includes associated patient counseling, which is mandatory in most places. Now, let's look at some history here. In 2007, a study, a total of 98 chain pharmacists responded to a survey, with 57% being about 60% if you, staff pharmacists. You know, the average age was 43, and mostly 60% of those responding were females. Now, 80% of all of those had an entry-level pharmacy degree, um, with 42% having the more recent PharmD degree, Doctor of Pharmacy degree, which I have, although I got it way before it was changed, it was mandated. Matter of fact, I was one of the first classes to get a PharmD degree from the University of Michigan. I won't tell you how long ago. Now, income data shows that 38% of those earn between $80,000 and $100,000, which is a good salary, no matter what time of the economic season you look at it. And 40% earned $100,000 or more per year. The average time worked per week was 38 hours. Not too bad. That's a darn good salary for that much work. Sounds good, doesn't it? Now, a majority, about 55%, indicated that patient care contact was the most satisfying aspect of their work, and I would agree with that. It certainly was with me when I was practicing pharmacy. Whereas 26% said that insurance issues were the least appealing aspect of the work. You know, unfortunately, when I was practicing pharmacy, it was long enough ago that I didn't have to worry about pharmacy approval, etc. It was a thing of the future with increasing medical and drug costs. One of the most frustrating aspects for those nowadays dealing with insurance and patients with unrealistic expectations. And the second was a lack of understanding, primarily by patients, for the challenges faced in getting physician authorization, you know that, or insurance authorization, and the paperwork involved. And many of you, like working in chain pharmacies, have to become experts in insurance authorization. It's mandatory. The patients don't understand why they don't get what they want always, and they don't understand why they have to wait. And it's frustrating, and it's not fun. This 2007 study indicated about 20% of those working in chain pharmacies were satisfied, and about 40% were somewhat satisfied. But remember, this was 7 years ago. That was a different time. And we're going to get to what follows from that in my next blog, which is entitled Unemployed PharmD Graduates. And I hope you look at it. I'm going to outline the history of education in pharmacy and what's happened, how it started, and how it evolved, and what's happened now, and the ability to get a job now graduating from a PharmD program, which is the only one left. It's now mandated. So I hope to see you on the next blog entitled Unemployed Pharmacy Graduates. And I also have a written blog. I'll put the address down for you on that one also, like I have on this one. So thank you for listening, and I hope you enjoyed this introduction into the unhappy pharmacist. Thank you very much.